It is now day 4 of our Black History Month series here on Wake Up Idaho. This year's national theme is focused on health and wellness, and today we're narrowing it down to mental health. Our Brenda joins us now to tell us more about the importance of mental health in the Black community.
Yes, Maggie, mental health is a difficult topic to discuss for many people, including the Black and African American population here in Idaho. On the bright side, more people are seeking help, but the demand for local therapists and counselors is increasing.
Black History Month serves as a time to celebrate the culture and the accomplishments in our communities, but it's also the time to talk about the aspects that rarely get discussed, like mental health.
A lot of the stigma was still around that idea that when we're going through something in our house, it's going to stay in our house, or we're going to go to church and we'll take it to the pastor and we'll get help that way.
The COVID-19 pandemic caused a spike in people dealing with mental health issues. 2 Idaho licensed professional counselors, Denisha Smith and Shantae Cohn, say that rise is also being seen in the Gem State's Black community.
Do you think people that are hit harder with mental health issues, predominantly, right now the Black culture, the Black peoples, but multiracial and biracial again, are hit very hard with mental health issues.
But there are obstacles that prevent some Black people from asking for help. According to the National Alliance on Mental Illness, 63% of Black people believe that a mental health condition is a sign of personal weakness.
It's seen as something's wrong with me. I'm going to go because something's wrong with me. So that's very, very hard to get people to be comfortable with that.
Another obstacle, the lack of Black mental health specialists.
Last time I actually went and looked and counted everybody up by their license, there's less than a baker's dozen of Black counselors in Idaho, all across Idaho, not just in the Treasure Valley. And so it's really difficult. People are full, people have wait lists. And I think it's difficult for clinicians because we want to be there to support Black mental health, and there's just not enough of us.
Cohn says Idaho's educational institutions do a great job of bringing in more Black and African American mental health students, but many of them are not staying after graduation. She says in order to help our Black population, we need to keep our mental health providers in the state to help meet the demand.
Unless we start promoting that and we start keeping our counselors that we're graduating here with incentives, I don't think things will change until we start having Black-friendly culture and encouraging Black therapists to stay here and to help here.
Both Cohn and Smith encourage anyone who may be struggling with their mental health to seek help now.
Come and have a conversation with someone and let someone say, thank you for sharing. That was so brave. And here's what I'm going to tell you about what I know about what you've shared with me, so that you can get some validation for your experience.
Battle the stigma, battle the uncertainty, and fight for yourself, because that's what it's about. You are worth that. You are worth living.
And Cohn says it's important for people to be able to talk to someone who can understand their cultural background. That means having access to more Black mental health providers is crucial in our community. And Cohn did give me a list of the current Black mental health providers in our state, and we'll have all that information on our website at k2b.com.
And that's the whole point of doing these mental health pieces in general, is lifting that stigma. It's not a sign of weakness if you need that help. Thank you so much, Brenda, for that report.